We know we have major cracks in our healthcare system. It's to be expected from any socialized healthcare system. But what if I told you that thousands of Canadians die every year while waiting for routine scans, diagnostic tests, and surgeries? According to secondstreet.org, more than 17,000 Canadians died on waitlists between 2022 and 2023. And all this is happening while we see more spending per capita in healthcare. So, what is the government doing to address this seemingly growing problem? Who exactly is dying on waitlists and how? And what does this all mean for you, the patient? Well, joining me now is Colin Craig, president of secondstreet.org and author of the group's latest policy brief titled Died on a Waiting List. Colin, thank you so much for coming on. I was kind of joking with you in some half joking way before we went on that we seem to always be talking about this topic, and it's quite jarring really that things don't seem to be improving.
No, no, they're going in the opposite direction. It's troublesome. And I'll just say, Tanya, one reason we started to look into this issue was because governments don't really talk about it. So often we see and hear about people dying while waiting for care that could potentially have saved their lives because either the patient has spoken out to the media before their passing, or maybe family members brought the story to light after the fact. So it's not because governments are transparent and accountable and regularly report to the public on this. It's because it was happening because of patients coming forward. So we started to look into this issue because we wanted to know just how often is this happening. And we find a whole bunch of cases of it happening. Sometimes they're quite troublesome. It looks like people are waiting for things like heart surgery and that before they pass away, and they're waiting longer than recommended wait times. And other times it's less significant cases where maybe someone's waiting for surgery on a finger or something like that. So there is a real wide variety of cases, but troublesome numbers for sure.
Okay, and before we delve into the data, share with our viewers, where do you get the data? If the governments aren't as transparent as one would like them to be, how do you collate all your data, and from where do you get it?
Yeah, it's a very good question. So governments across the country, they have waiting lists, and they often keep track of who's waiting for various procedures in government databases. And when it comes time to when a patient passes away, quite often the government will maybe phone the patient to schedule something about their surgery, and a family member says no, that patient's actually passed away. Or sometimes the family member will proactively call the government and say, my husband or my wife, they no longer need this procedure because they've passed away. So in both cases, you end up with government people who manage these databases deleting them from the list, saying they don't need that anymore. And I think what generally happens is there's a option for why someone would be removed from a waiting list, and the person who manages the list would select from various options, one of which would be the patient passed away. So they click it, and that seems to be the end of it. From what we can tell, governments don't really look at this data to see how often patients are dying before they get the care they need. It happens to be some data they collect, and so we ask for the data across the country every year. We have to file a whole bunch of information requests. It's a huge undertaking.
Sure.
Uh, it's nationwide with hospitals, health regions, provincial health bodies, whoever it is that tracks the data. And we accumulate it. It takes several months to gather it all, and then we try to summarize what's happening in the country so that people can understand more about what's going on.
Yes, my goodness, it's definitely a huge undertaking, and I have to say, I appreciate your organization doing that, secondstreet.org, because even though I'm, very active in various things with public policy, I don't really know that problem of dying on wait lists, that it is such a huge issue until you really just look at the numbers, and it's quite staggering. So maybe give us some of the data. We have about 45 seconds to commercial, but what is the data telling us?
Yeah, so the data shows that for last year there were about 17,000 people that died while waiting for various surgeries and diagnostic scans. And a lot of health bodies didn't actually give us the data, or they don't track it. So, I say 17,000, it's the true number is probably close to over 30,000 when you start to extrapolate it nationwide for cases where there is no data. And like I
Wow.
said, a variety of different procedures that people are waiting for.
That's a staggering number, extrapolating to 30,000. I thought 17 was already so catastrophic. Well, we're going to unpack some more of this data when we return from this commercial break. Please stick around.